Would a healthcare staffing agency need to be a Medicaid provider? The answer to that is no. As a healthcare staffing company, you are billing the company. It's a business to business service. So just to kind of give you how, like, the schematics of it, we use a nursing home as an example. A nursing home is going to be accredited by JACO, CHAP, ACHC, whatever. That accreditation is going to allow them to bill Medicare, potentially Medicaid, depending on the state. And most private insurers are going to expect you to be accredited and Medicare credentialed in order to even be a network and pay you, right? If they pay for skilled nursing admissions. Okay, so that nursing home or nursing facility is in contract with those payer sources to provide a service, a bed, and skilled nursing services or nursing home services to that particular client. They need staff to do that, right? So when Savvy Business Chick goes on maternity leave and they have 12 weeks of an opening, they will hire a staffing company to fill that gap, right? So I turn around, I send them a nurse. That nurse is working under the license and accreditation and all of those things of that facility. All you need to do is send them a qualified employee, and they pay you for that qualified employee, and you pay that qualified employee for the work that they do, and you make a spread between what the nursing facility is paying you and what you're paying your worker. So you're not billing Medicaid or Medicare or any of those payer sources. You're billing the business themselves, who is billing the payer source. Okay, so when you go into healthcare staffing, and this is why I say it's easier and probably the better route for most people, is you don't have to deal with the credentialing bodies. That's not your business. You don't need to deal with the state surveys. You don't need to deal with any of that. All you need to do is recruit and find competent staff and handle your HR functions and handle your billing functions, right? You're going to need a way to collect their time and attendance. You're going to need a way to get your contracts. You're going to need a way to handle your payroll, and you're going to need a way to find people to work for you. That's it. You don't need to worry about regulations. You don't need to worry about injury to your work. Well, you need to worry about injury to your workers through workers' compensation insurance, but you're not going to have to worry about maintaining general liability insurance for that particular facility. You're not going to have to worry about the state knocking on your door about are people being treated properly, or your sheets properly clean. The things that they do, that's not your concern. Patient charting, not your concern. Even if your nurse is there doing a crappy job, that's not your problem. That's the nursing facility's problem for keeping them on the unit and allowing that crappy charting. So I would, just to answer your question, you do not need to be Medicaid credentialed or Medicare credentialed or credentialed by anybody unless your state requires you to be registered in the state, like in Florida, for instance, right? A nurse's registry must be registered. Some states don't have that provision, and it may only be for nurses and not for physical therapists or x-ray technologists or respiratory therapists. It may only be a nurse thing. Nurse aides may not fall under that scope. So, you would check with your Department of Health, your state Department of Health, to determine whether or not your operation is going to require a license. It usually does not, because you're functioning under the license of the facility that you're servicing.